At least 11 states in the U.S. have reported cases of the Omicron variant. As of Saturday morning, health officials had confirmed the strain from Hawaii to New York. Doctors warn it likely has already become more widespread. The majority of cases here in the U.S. are considered mild. They've been mostly found in vaccinated people. And while the new variant is getting a lot of attention right now, the CDC had a reminder Friday that the Delta strain is still killing roughly 1,000 people here in the U.S. every day. CBS News' Tom Hanson has more.
COVID cases driven by the Delta variant are rising, averaging 96,000 new cases a day and hitting hard in the upper Midwest to New England. New Hampshire led the country in new cases per capita last week.
99.9% of cases in the country right now are from the Delta variant.
When it comes to the Omicron variant, health officials are counseling calm.
We are equipped and prepared to fight the Omicron variant head on.
There's every reason to believe that if you get vaccinated and boosted, that you would have at least some degree of cross protection, very likely against severe disease, even against the Omicron variant.
But Omicron spreads twice as fast as the Delta variant, and this week, mild cases of the strain, first identified in South Africa, popped up in multiple states, including Maryland, where Governor Larry Hogan had just announced an aggressive partnership to find COVID cases fast.
The state entered into agreements with both Johns Hopkins and the University of Maryland to more than double our already aggressive real-time variant surveillance.
For international travelers, they will be required to take a COVID test 1 day before boarding a flight to the U.S. from a country where Omicron has been detected. And once they arrive, many airports have on-site testing.
Personally, I don't have a problem with that. If they make it available at the airport, if they make it free and hopefully quick, then yeah, I don't have any issue.
So far, 34 countries have identified cases with the Omicron strain.
Now is not the time to relax. We're seeing this variant of concern, and the way to address variants is to slow COVID transmission. And we do that through vaccination. We do that through masking.
And from Dr. Anthony Fauci,
get vaccinated and get boosted.
And joining us now for more is Dr. Jeremy Faust. He is an emergency physician at Brigham and Women's Hospital and a professor at Harvard Medical School. He's also the author of Inside Medicine. Dr. Faust, welcome. Health officials are urging Americans to get vaccinated, get boosted. Is there any information yet about how effective our current vaccines are against the Omicron variant?
Thanks for having me. I think the information that we have about the vaccine is highly anecdotal. We are still getting stories from the field. And I've been speaking to my colleagues who work in hospitals in South Africa, and what we're hearing is good news, but the problem is that the numbers are too small to make any conclusions. Now, that being said, if the opposite were true, we'd be worried. If I heard that the first 10 cases that a colleague of mine saw were all people who'd been boosted and they were still getting sick enough to be on ventilators or dying, I would be very worried early on. But right now, with the numbers we're hearing about, it's just too soon to know if Omicron is behaving in a different way than the previous variants. I suspect that based on what we know about the genetics of this virus and also the early information we're getting about its behavior, that certainly it's more contagious and it might cause more infections among people who've been vaccinated or previously infected. But we really have no inkling to suggest that that means that we have forfeited the protection from other outcomes like serious illness.
Okay, I want to follow up with you on that point because so far in the U.S., the people testing positive for Omicron have largely been vaccinated. This might be misleading to people who are hearing this. I'm hoping you can help us understand a little bit more about how you hear that information.
Well, one thing you have to keep in mind is who are you testing? So, for example, if you're in a hospital setting, you are testing people who are coming in because they have symptoms in most cases. So among a sicker cohort of people, that's one magnifying glass. And I think that we'll probably learn that in that situation, people with vaccines are doing much better, but we'll see. On the other hand, if you were to test 100 people who are worried that they were at a super spreader event, many of them may be asymptomatic or have mild symptoms, and it could turn out that a high number of those people were vaccinated. And so you might get the idea that the vaccine doesn't protect you. But the two different testing environments are really the whole story there, aren't they? Because in one situation, you're saying, okay, among the sick people, how many are vaccinated? Hopefully very few, and that's what we're hearing anecdotally. Versus among the people who just happen to have gotten this infection and who aren't suffering at all, how many of them are vaccinated? Well, a higher number, but that's okay because maybe that just means the vaccine is doing its job. Again, until we have real data, these anecdotes can only guide our needle a little bit, and we have to wait.
Preliminary research shows that at least one of the mutations in the Omicron variant may have come from the genetic makeup of the common cold. What would this mean for the transmissibility of the virus?
Yeah, this is a very interesting finding, and common cold is a pretty big umbrella. There are coronaviruses and there are adeno and rhinoviruses. There are many different kinds, and coronas have been with us for all of time. And we know that all viruses mutate every time they replicate. So to me, the number one thing people should know is that if you want to be a part of stopping this pandemic, then being vaccinated and avoiding infection is really powerful because you give the virus fewer chances to mutate when it copies itself. Now, this information about the common cold, the common coronavirus, may be being integrated into this coronavirus, the SARS-CoV-2 that causes COVID-19. This is new and this is interesting. We know this can happen. This kind of thing happens much more frequently with influenza because there are multiple strands of genetic material in flu. And so you can kind of mix and match and sort of form these Frankenstein mutants that can cause all kinds of terrible disease. With coronavirus, it's a little bit different because there's a single strand of genetic material. And so this is more of a little bit of like a swap, a mix and match. And that can happen. We know the genetics can happen. But it's also likely that these similar mutations can happen spontaneously. And if they have an advantage, if that mutation gives the virus an advantage in surviving, then it would also just persist. So we don't know whether this is a mixing event or just another spontaneous mutation. But either way, the message is the same. The more times this virus copies itself, the more opportunities it has to create new versions which give us a headache and worse.
Yeah. Still here in the United States, more than 99% of COVID cases are Delta variant related infections. But as you heard my colleague reporting, early data indicates that Omicron spreads nearly twice as fast as Delta, and it took just 1 week for Omicron to become the dominant strain in South Africa. We heard Dr. Fauci say that he believes that it's already more widespread here in the U.S. than we know. We've seen it expanding now to nearly a dozen states. So, Dr. Faust, how long do you project it will take before Omicron potentially becomes the dominant strain in the U.S.?
Well, I wouldn't want to make that prediction, but I would say that I think that is a very important piece of information. Look, there's one thing to say, look, we're reading the genetic material, we're looking at it on our computer screens and in our laboratories, and we think that means something. And that technology is really still in its infancy. We've gotten better. And I suspect that during this pandemic, we're going to get better and better at that so that every time a new variant shows up, we can know more about it and we can guess more about it correctly earlier and respond correctly. What I think is fascinating here is the epidemiological data is really early. We don't yet know. And I think that any time you see a variant take over quickly, that gives you pause. That tells you, look, maybe this was a good call to get ahead of this, even though we hadn't yet seen, when we first started hearing about this, it was really so early. So I think that I really give credit to the scientists for sort of identifying and red flagging this early on. But I think that overall, the message is the same. When we have an outbreak, we want to do the things that slow this down. And I think that, vaccinating, even though we're still worried, could there be escape? Could the vaccines not work? I don't think that that's likely to occur. I agree with Dr. Fauci. I think it's likely that we'll have some protection, if not a great deal of protection from our vaccines and boosters for those who need them.
Well, the Biden administration announced that they're taking steps to expand free at-home testing to all Americans. What's your take on this plan, and how effective do you think it will be in fighting against not just Omicron or Delta, but potentially any other strains that pop up?
I've been talking about rapid tests for over a year now, and I've always felt that they were misunderstood and underutilized. When the Biden administration came into office, I worked the phones. I don't do any work for any testing companies. I don't see any money from that, but I just believe in the idea that if people can get an immediate result about whether they're contagious or not, that is much more powerful information than people realize. So yes, it doesn't 100% rule out an infection. It rules out, hopefully most of the time, actually, that you're contagious. So I think it's a huge, huge step in the right direction that earlier this fall, the Biden administration made 25 million tests available, and then now they're doubling that in communities. This idea of having free rapid testing and the way that it's going to be done is through reimbursing through private health insurance. That's a head scratcher to me. I don't think that's really the best way to achieve this. There's a word for this. It's called sludge or red tape. But there's something that stands between you and doing something. It's just paperwork. You're not going to do it. And so people are going to have to go and buy the test, pay retail prices, fill out the paperwork. This is really not the kind of thing that encourages people to do what they want to do, which is to get tests. I think that we have the ability and we have the resources to make these tests widely available, truly for free at the point of delivery or sale. And quite frankly, I have never seen a model that shows that spending a little bit of money on that doesn't save you money, let alone lives down the road. So yes, I'm very pleased that rapid tests have become a bigger part of the plan and a bigger part of the conversation. But I think that we could do much better by making these very, very easy to get.
Dr. Jeremy Faust, appreciate you coming on and answering all of our questions and appreciate all that you do. Thanks.
Thank you so much.